We're diving into some really exciting stuff today, folks. A potential game changer in the world of sleep medicine.
Oh, yeah. You got my attention.
You and every sleep specialist out there, I bet.
Yeah.
Because we're talking about a therapy that could revolutionize how we approach OSA.
Okay, lay it on me.
It's called Kairos positive airway pressure.
KPAP for short.
KPAP, huh? I've heard whispers, but I haven't really dug in yet.
Well, get ready to dig in because this isn't just another tweak to CPAP. It's a whole new philosophy.
All right, color me intrigued. What's the big idea?
It's all about delivering pressure only when it's truly needed, right at the end of expiration.
So instead of that constant pressure of CPAP.
Exactly. And that right there is the key to why KPAP is generating so much buzz.
Makes sense.
Mhm.
We've all had patients who describe CPAP as feeling like they're suffocating, fighting against that pressure.
You hit the nail on the head. With traditional CPAP, we're basically battling the patient's natural breathing cycle, applying continuous pressure, especially during inhalation.
Which, let's be honest, probably isn't helping with airway stability, right? And on top of that, it might even be triggering treatment-emergent central sleep apnea taxa.
You're talking about the therapy itself causing central apneas.
Precisely.
It makes you wonder how often we're actually seeing that in patients who didn't have central apneas before
A
CPAP.
valid concern, and one that KPAP aims to address.
So how does it actually work, this whole Kairos concept?
Well, Kairos is an ancient Greek word meaning the opportune moment.
Okay, I'm seeing the connection.
And that's exactly what KPAP does. It delivers pressure at the precise moment needed to support the airway, not a moment sooner.
Interesting approach. So less pressure during inspiration and most of expiration.
You got it. It's all about working with the patient's breathing rather than against it.
Sounds good in theory, but does it actually work? Can it really stack up to CPAP in terms of treating OSA?
That's the remarkable part. There was a landmark study published in Sleep Medicine comparing KPAP head-to-head with CPAP.
And don't leave me hanging.
The results were incredible. KPAP was just as effective as CPAP in treating OSA.
Okay, that's promising. But efficacy alone isn't enough. We need something that patients will actually use.
And that's where KPAP really shines.
Yeah.
Get this, 93 to 95% of the patients in the study preferred KPAP over CPAP.
Whoa, hold on. Those are some seriously impressive numbers. We're talking at a level of patient preference we haven't seen with any other PAP therapy.
It's pretty groundbreaking, and we're just getting started.
Okay, I'm officially on board. What about pressure levels and air leaks? Any improvements there?
Absolutely. They found that KPAP achieved similar therapeutic results with up to 5 centimeter H2O, less pressure than CPAP.
Less pressure, better comfort. That's a win-win.
And it gets even better. Air leaks were reduced by a whopping 50%.
If those results hold up in larger trials, we could be looking at a real game changer. And you said this is more than just a tweet CPAP. So how does this technology actually work? What's the secret sauce?
It all comes down to a unique algorithm that constantly analyzes the patient's airflow and adjusts the pressure in real time.
Real-time adjustment. That's impressive.
And we're not just talking about delivering pressure at the right time. It's about delivering the right amount of pressure at the right time.
So it's a truly adaptive system. Fascinating. But how responsive is this algorithm really? We've seen other smart PAP devices that claim to adjust to the patient's breathing, but they often lag behind or overcompensate.
That's what sets KPAP apart. The pressure adjustments are incredibly fast and precise.
And how do we know it can actually keep up with those changes in breathing?
Well, there's this great anecdote about patients trying to trick the device by intentionally changing their breathing patterns.
Clever patients always trying to outsmart the technology.
Right. But the amazing thing is that KPAP adapted flawlessly every time.
Now that's what I call smart technology.
Yeah.
Okay, you've sold me. I'm officially intrigued by this KPAP, so tell me, when can we expect to see it hit the market?
The developer Sleeplers are aiming for a U.S. release in 2025, pending FDA clearance, of course.
2025. All right, mark your calendars, everyone, because this could potentially shake up the whole sleep medicine landscape.
Exactly. Will this make traditional CPAP obsolete? It's a question we'll need to grapple with as KPAP becomes more widely available.
Too early to say for sure, but I think one thing's clear: KPAP is going to force us to rethink our approach to OSA treatment.
I agree. If we can achieve similar efficacy with greater comfort, that's a huge win for both our patients and us clinicians.
Couldn't have said it better myself. But before we get ahead of ourselves, there's a lot more to unpack about KPAP.
Absolutely. We need to delve into those practical considerations, like cost insurance coverage, physician training.
All crucial factors. So where do we go from here?
Well, before we jump into those aspects, let's take a closer look at what makes KPAP so unique.
Sounds good to me. Let's break down some of the key features that set it apart from traditional PAP therapy.
We were talking about how KPAP could really shake things up, but I'm sure you're thinking, okay, this all sounds amazing in theory, but
Hmm.
how does this actually play out, in a real clinical setting?
That's the million-dollar question, right? I mean, trials are one thing, but the real world is a whole other beast.
It is. So let's talk practicality. What are the biggest things you'd be thinking about if you were going to start using KPAP with your patients?
Well, first off, we got to be realistic. KPAP isn't some magic cure-all, right? It's not going to be the right fit for every single OSA patient out there.
So it's more about expanding our options, not necessarily replacing CPAP altogether.
Exactly. It's about having more tools in our toolbox so we can tailor the treatment to each individual patient.
I like the toolbox analogy. So for example, you're thinking about patients who just haven't been able to tolerate CPAP.
Right. Those folks who struggle with the pressure or have constant mask issues, KPAP could be a game changer for them.
It might be the thing that finally gets them the therapy they need.
Exactly. And then there are those patients who develop TEXA on CPAP. Could KPAP be a safer alternative for them? That's a big one.
Yeah, that's a crucial question and one that I don't think we have a definitive answer to yet.
Not yet. We need more research.
Mm-hmm.
But the thinking is that because KPAP has lower inspiratory pressure, it might be less likely to mess with the respiratory drive.
Which could potentially mean a lower risk of TEXA.
Exactly. But again, more data is needed.
Okay, so let's say we've got a patient who we think is a good candidate for KPAP. What are the next steps? Is it basically the same as starting someone on CPAP, or are there things we need to do differently?
Patient education is absolutely key. We need to really explain how KPAP works, emphasize that it's not constant pressure, and that they might actually feel less pressure compared to CPAP.
That makes sense. I mean, it's such a different approach. We need to make sure patients know what to expect.
Absolutely. We don't want them to be surprised or think something's wrong.
Right. And what about us, the clinicians? Do we need special training to prescribe and manage KPAP therapy?
Definitely. It's not just a new device. It's a whole new way of thinking about OSA treatment.
So it's a paradigm shift.
Exactly. We need to understand how that algorithm works, how to interpret the data it's giving us, and how to adjust the settings to get the best results for our patients.
Sounds like there's a bit of a learning curve there. What kind of resources are available for clinicians to get up to speed on all things KPAP?
Well, professional organizations are starting to offer workshops and training programs specifically on KPAP, and I expect we'll see more and more educational materials and guidelines coming out as we get closer to the market release.
It's almost like we need to learn a new language.
Yeah, we got to be fluent in KPAP to really guide our patients effectively. And speaking of guidance, what about mask fitting? Is that any different with KPAP?
That's a good question. I was just thinking about that.
Well, the basic principles are the same, of course, but there are some KPAP-specific things we need to keep in mind.
Like what?
Well, because the pressure fluctuates more than with traditional CPAP, getting a good seal is absolutely crucial.
So we can't just slap on any old mask and call it a day.
Not necessarily. We might need to try out different mask types and sizes to find the perfect fit for each patient.
Gotcha. So we've got patient selection, patient education, clinician training, mask fitting. What else should clinicians be prepared for when it comes to KPAP?
Monitoring is huge, just like with CPAP. We got to keep tabs on how our patients are doing things like usage hours, pressure levels, leak rates, any side effects they're reporting.
The usual suspects.
Right. But the cool thing about KPAP is that it gives us a ton of new data that we didn't have before.
Oh, really?
Yeah, which allows us to really fine-tune the therapy and personalize it even further.
That's amazing.
Hmm.
So it's not just about collecting the data. It's about understanding what that data is telling us
Yeah.
about the patient's individual response to KPAP.
Exactly. We're moving away from a one-size-fits-all approach and entering the era of precision sleep medicine.
I like the sound of that.
Yeah.
But of course, with any new technology, there are always going to be challenges and unanswered questions.
Absolutely. So what are some of the big research questions that still need to be answered about KPAP? What are we still scratching our heads about?
Well, one of the big ones is how KPAP performs in larger, more diverse patient populations.
Right.
I mean, the initial studies have been really encouraging, don't get me wrong.
Yeah. But they've been relatively small and mostly focused on folks with, uncomplicated OSA.
Makes sense. So you're wondering about patients who have other health issues on top of OSA.
Exactly. What about folks with comorbidities like heart failure or COPD? Could KPAP be helpful for them? Could it actually be harmful? Those are questions we need to answer.
Yeah, those are crucial considerations.
Yeah.
Because we know that untreated OSA can actually make those conditions worse.
Right. So it stands to reason that effective treatment could have a positive impact.
Potentially. but we need more data to say for sure.
Absolutely. And beyond just managing those specific conditions, I'm also really interested in seeing what kind of impact KPAP has on long-term cardiovascular health.
That's a big one.
Huge. I mean, we know there's a strong link between untreated OSA and things like heart disease, stroke, even early death.
Right. It's a serious issue.
So if KPAP can really move the needle on adherence and treatment efficacy,
Yeah.
could that translate to better cardiovascular outcomes down the road? That's what I want to know.
That would be a major win for our patients for sure.
Absolutely. Reducing the risk of those major health problems would be a game changer. And it's not just about physical health either.
Right.
I'm curious to see how KPAP affects things like cognitive function, mood, overall quality of life.
Makes sense. I mean, if people are sleeping better, feeling more rested,
Exactly. It could have a ripple effect on their mental and emotional well-being.
sleep impacts every aspect of our lives. So-
Exactly. And while we're talking about improvements,
Yeah.
one thing I'm particularly interested in is long-term patient satisfaction.
Okay. How so?
Well, we know from the trials that people tend to prefer KPAP to CPAP, at least in the short term.
Yeah.
But will that hold up over months or even years of use?
Right. Will they still find it comfortable and easy to use?
Exactly. Will they actually stick with the therapy? That's the key.
We don't want to get too excited and assume that KPAP is some kind of cure-all.
Right. Oh, definitely not.
We need to see how it performs in the real world over the long haul.
I completely agree. And on top of that, we need to keep an eye on how the technology itself evolves.
Right. What's next?
Yeah, will we see new and improved algorithms, advancements in mask design, or other features that make it even more comfortable and effective?
It does feel like we're just scratching the surface here. There's so much potential.
It's an exciting time to be working in this field, that's for sure.
It really is. And while there are bound to be challenges along the way,
Oh, of course.
I think we're both optimistic about the future of KPAP.
I am. I really am. Continued research and innovation, I think those are the keys to unlocking KPAP's full potential.
I couldn't agree more. Well, this has been a fascinating deep dive into the world of KPAP. Thank you so much for sharing your expertise and insights.
My pleasure. It's been great conversation.
To our listeners, we hope you found this discussion informative and thought-provoking. As KPAP becomes more widely available, be sure to stay curious, stay informed.
Absolutely. Talk to your colleagues, stay up to date on the research, and most importantly, consider whether this new therapy might be right for your patients.
It's an evolving field, and we all need to stay ahead of the curve.
Couldn't agree more. The more we learn about KPAP, the better equipped we'll be to provide the best possible care for those struggling with OSA.
That's what it's all about at the end of the day. Well, on that note, we'll wrap things up here. Thanks for joining us on this deep dive into KPAP Sleep Well, everyone.